Alrighty, well, it's just now 3 o'clock, and so we can get started. I want to welcome anyone and apologize if anybody had any confusion joining. If you have questions, just feel free to email me. Also, I'd like to thank many of you for submitting your big, hairy advocacy goals to me. I'm keeping those on file and reviewing them, and we're going to kind of discuss that in the end when we talk about final projects. But our first webinar post-P&I, which is hard to believe it's already mid-April, is engaging patients and staff in grassroots advocacy. And so it's pretty brief. I definitely want to have a discussion a bit at the end, but it's really going over how to get your colleagues and patients to act and to be engaged in your health center's advocacy, and then, of course, get them involved in the broader health center advocacy network. As I said before, if you have a question during the webinar, you should see listed on the side an opportunity to use the chat box. You can either send the question directly, to everyone if you wish to do that and get everybody engaged, or you can send it directly to me, and then I will do my best to make sure that I'm responding to those questions. And if we don't get to every single one of them, which I don't think will be a problem, then I will follow up with you. So today, as I said, it's a pretty simple agenda. We're going to go through ideas for engaging your colleagues and staff members in grassroots advocacy, and then ideas for engaging health center patients. And then we're going to have a little bit of a discussion, and then I'd also like to, just provide an update and some feedback and ideas on the advocacy projects. And which is exciting, I've already heard from many of you about some of your interest for those projects, and I think it all sounds very, very creative and great. So we will go through that. So, okay, kicking it off with engaging staff. So what is employee advocacy? Well, if you look at a business definition, more from the private sector perspective, it refers to the promotion of an organization by its workforce. So in this case, obviously, health centers aren't necessarily selling a product, as we know, but they're serving the community. And so the goal is to make sure that employees and that staff are also, promoting that work within the community by being engaged in advocacy. And you can look at it like that. Here are just kind of some five simple steps. I actually was just doing some research myself for something else, and I came across a couple of things to add in. So 5 simple steps to engaging your staff in advocacy is obviously making workplace culture a priority. And so this would be identifying your health center as an industry leader, and also as an organization that's inspiring innovation, which hopefully you guys have seen before the hashtag CHCs Innovate. But health centers are changing the healthcare system and the primary healthcare system in a multitude of ways. So, by doing that, you're kind of inspiring your employees and letting them know that it's not just average, primary care work. Oh, there's patients, there's a provider. We're really, making a difference within the landscape of public health. So that's a way to look at it, kind of that motivation piece. The other thing is to give back through initiatives that show your health center's ties to the community. I think a perfect time to do this, and every year it's National Health Center Week. Several health centers across the country host screenings. They have, events that are open to the public where folks can come in and get, kind of an array of services that they need. Take the time to do those sort of service activities that show, just how close the health center is to the community, and that will also inspire employees as well. And then the other thing, of course, is to encourage communication and an open communication space. So by that, taking feedback from employees about, what they view in terms of, what they think advocacy is, how they believe that it should be carried out by the organization. Be sure to take that feedback, and that kind of goes into getting the employees on side. You know, you want to showcase the benefits of becoming an advocate. At the health center, what is a benefit of being an employee advocate? Well, maybe, you know, there's an incentive there. Maybe there's, you know, a better opportunity to get connected in the community. Maybe there's, you know, opportunities for cross-collaboration with other organizations. You know, recognize good work that people do. One of the stories that we had from, I think about 2 years ago with National Health Center Week was a health center had a security guard who was constantly engaging patients in the waiting room and actually letting people know, you know, where they could sign up to be an advocate. And he was, of course, recognized by you know, his colleagues at the health center and all that. We ended up doing a blog post and all that. But really why he was doing that was because he saw the work that the health center was doing in the community, and he felt like if he was going to be an advocate, he should encourage patients to do the same.
Driver's license.
If, just as a note, again, if you weren't on before, and I see some people have joined with video, but if you are on the phone, if you could mute your line just so others are able to hear, and then we'll open it up later for questions. The third thing would be to establish goals. You'll want to be sure that you've actually, you know, thought about what you're trying to do. Do you want to have 100% of your employees signed up as advocates? Are you trying to, you know, do some type of civic engagement activity where you're providing resources to the community so they can, you know, register to vote, things like that? What are your goals for, you know, another goal could be, you know, we're trying to build our social media presence, but what are your goals for your advocacy, and what do you ultimately hope to do by engaging employees? I just had a message, I'm sorry, excuse me, but from one of the participants, and there seems to be some background noise. I'm not sure who it is who is with a young person or a child in the background, but if you could please mute your line, that would be appreciated. The final step would obviously be appointing a leader to carry out and to lead up the efforts for advocacy at the health center. And in this case, that would be you all. You guys are part of the advocacy leadership program. We're hoping that you will be, you know, the grassroots coordinators or the leaders at your health center, kind of leading the charge for advocacy and getting people engaged. So that would be, you know, the final, you know, kind of the fifth and most simple steps since you're here on this webinar today. When you're talking to your staff and you're trying to make sure that, you know, you're giving the proper message for advocacy, make sure that you know your colleagues and you know what they're dealing with and how the workflow is and what the culture is, as we discussed before. I mean, you know, if you know that you've got a very, you know, a very busy staff and you know that, you know, each day, you know, people are, you know, are running, which I would say is probably the norm, and that they may not have time or they may not understand, you know, all the reasons and the ins and outs. Make sure that you're making the message so that it's relatable and something that's easy to do. And you want to, you know, bring it home. Maybe it's your CEO who's giving the message of why it's important to be an advocate. Or maybe it's, you know, maybe it's a provider who's been at your health center for, you know, 30, 40 years, you know, hearing it from somebody who can really make the message resonate as to why it's important to be engaged in advocacy. And also you want to make sure that they understand why, you know, why they should care. Why does it matter? What does advocating for my health center at the state level or at the federal level really mean? And of course there you'll want to provide, and we kind of go through this a little bit later, but you want to provide some data and some information around, you know, what it is that's making your health center operate, other than obviously the team and the staff itself. It would be, you know, you're relying on funding, you're relying on, you know, certain policy. You know, you want to make sure that those points are very, you know, are outlined in a very succinct way so that people understand, you know, why it matters. The other thing is, and we talked about this, or I just mentioned this before, is the communication. making advocacy a part of your day-to-day culture. You can make a standing agenda item, during your all-staff meetings about advocacy. This could be, just a quick update. It doesn't have to be anything too elaborate, but, hey, our update this week on advocacy, we got 25 sign-ups here at the health center, and we have 10 more patients that, that have also signed up, and we've reported this information back to NAC. They have us in their system. Now these people are receiving national updates, and now they're also receiving our monthly newsletter. Another way to make it a part of the culture, making advocacy a part of the culture, is to include that as part of your staff orientation. When people are in the midst of filling out their, the various forms that you do when you're starting a new job, you could also have a form that says, hey, put your name here if you're interested in registering with the Health Center Advocacy Network. This is the information that you'll get by signing up. You'll also receive updates from, our health center or our state regional primary care association. But make it one with your onboarding process if that's something that will work at your health center. But obviously, with that, just as an aside, you'll want to make sure that you've got your board's buy-in and your CEO's buy-in, of course, when you're doing something like that. The other thing is making sure that your colleagues and your staff, your fellow staff members, are staying connected. You can do that by, of course, directing them to ALP Advocacy. They can sign up. They can get our national updates. They could also get, they could get the Washington update, action alerts, things of that nature. You can send, summary emails to staff. One thing I always say is if you are going to, contact your staff and update them on advocacy, feel free to use, kind of what we've sent out as a guide or as a template, if you will, and you can, let them know what the calls to action are, what the goals are, things like that. I would definitely recommend maybe putting up, flyers of, related to your advocacy efforts, or just information, in your common areas and break rooms. Let's say there was a petition or something that you were collecting signatures for. That's another thing that you can put there. Very easy. It's an easy, simple way to take action. You could also have volunteers. It asks, tap people to kind of spread the news within the community, and amongst, other people at the organization, depending on how big your health center is. And then the final thing could be, using social media. There are a couple of examples of this, but one thing that I've seen, at least that I saw recently when we did the red alert for health centers during our efforts to fix the cliff, was not only was the health center itself, posting on social media, encouraging Congress to act, but actually people who were working at the health center were doing that as well. So it amplified those efforts, and you can also post updates, in regard to your advocacy, on there for patients to, for employees to see, of course, as well. Then of course, the primary goal of advocacy and for getting your staff engaged is to then, of course, move them to take action. So, you want to set a goal, you want to create a competition, and, in some instances, you might want to incentivize things. When you set the goal, like I said, we want to make sure that everybody at our health center called their member of Congress, and, we want to have a record of it, so everybody's going to, we're going to host a call-in day, with 100% participation. That could be the goal. Maybe you create a competition. Maybe there's another community organization or another health center, in the next town over, and you can say, hey, how many calls did they get today? We got this many. You can make it fun, make it something that obviously you're both working towards the common goal. But after all of that, you also want to incentivize it. Maybe, hey, for every employee that that actually comes in and participates in this call day, or volunteers to register patients to sign up as advocates, they'll get a a Starbucks gift card or a Target gift card, something that makes it fun and makes people feel like they've done something and they're getting a little bit of a reward for it. The other thing is, after the action has been taken, you'll want to follow up. Nothing's worse than if you say, hey, you know, we need everybody to make, you know, tons of phone calls today, and then you never say, well, what the outcome of those phone calls? Well, you know, after we called Senator Johnson's office, you know, 40 times, you know, he finally decided that he would sign on to, you know, a letter supporting health centers, and which means X, Y, and Z. You want to be sure that you're, you know, giving kind of an answer to the call to action, and then, you know, find out exactly who did what, and make sure to recognize them as well. You know, if somebody went above and beyond, you know, make sure that you're giving them kudos for that. And then, of course, whatever the ask is, you know, that whether you're asking employees to, you know, sign up as advocates, whether you're asking them to engage in some type of advocacy day, or, you know, or whether, you know, it's participating in a specific event, make sure that everything that you want them to do is organized and available. You know, so if you have a sign-up sheet, you know, if you want people to sign up, make sure that there's a sign-up sheet there. If you want people to make phone calls, make sure that you've kind of designated, you know, a calling center. But all of that, make sure that you've gotten that prepared and kind of thought through the steps so that it's very easy for people to get engaged. So moving on from engaging staff is engaging patients, and I know that that's something that's come up a lot recently. There have been quite a few requests from the field, and just generally, you know, kind of talk more about engaging our patients in advocacy and just in general in the work that we do at NAC. You know, the first things first, you know, as we talked about with engaging staff members, is that you want to make sure that you have the right message. So again, maybe you don't approach your patients the same way that you would approach your staff, right? If, you know, maybe people who are working on the, you know, on the side of the health center would understand more if you say, you know, we're at risk to lose, you know, 70% of our funding. Well, maybe for a patient, somebody who's receiving services, that doesn't really, you know, maybe that doesn't resonate as much with them, or maybe it's a little bit more alarming, or maybe it's, you know, or maybe it's not alarming. You know, you want to make sure that the message is really crafted for the patient. You know, maybe starting out by, you know, explaining the work that your health center does and the impact that it has specifically in that community, you know, the kind of services that you're providing. And also maybe, you know, there doesn't always have to be as much urgency, I would say, you know, just kind of an ongoing, you know, this is what we do and this is why we want you to be involved. Once again, you're going to want to make sure to emphasize why they should care about advocacy. You know, you could say, you know, you receive your care here, you know, you're able to get, you know, screenings, you're able to get, you know, your various vaccinations, you know, whatever it is. And, you know, this is why you should support your local health center. This is why we need you and your voice as well. But, you know, and so that kind of leads me to the other point, which is, you know, making the case beyond the health center. How does their advocacy contribute to the whole community? If they are, you know, standing up and raising their voice on behalf of their health center, they're not only, you know, just doing that for the health center, they're doing that for everybody else who may be, you know, maybe other at-risk patients, or maybe other people who need to have access to primary care in the community. You know, in terms of communication, there's a couple of things. You know, first of all, we all know that patients, you know, your communication with patients is based on, you know, how much information that they give to you, and also in some instances, you know, the consent that, you know, that they've given, you know, how they want to be contacted. So you want to be sure that, you know, if you're engaging patients, you know exactly how they want to hear from you. If a patient has given you their email, or if you have access to their phone number and you're sending text reminders, you know, like, you know, this is the time of your appointment and things like that, you know, maybe that is a good method to say, hey, you know, your appointment is today, but also have you learned, what is your knowledge of our advocacy, or have you signed up to be an advocate? Maybe, you know, if you know that you have patients that are checking your social media pages, that's something that you post from time to time. You know, here's how you can become involved in advocacy. You know, here's a link to our website, learn more here. You can also just do, you know, word of mouth. You can train staff, you know, back to what I was saying about incorporating into the culture, to mention advocacy, when they're engaging with patients. This can be front desk staff, outreach, promotorists, clinicians, whoever you want it to be. And then if you don't want to do that, if that's not something that you're comfortable with, you can always post something again in the waiting room. You can have flyers, you can have handouts, and you can make that information available, something that they can just take away with and just have, hey, this is some information about where you can sign up and learn more, and that's just something that they're taking away along with other stuff that they're taking away from after their appointment. If you do need any type of template or anything for that, we have sign-up sheets, we have sample flyers, we have scripts that you can use, and they're available on our website. But those are just some of the ways that you can communicate and let them know of your advocacy efforts. The other thing is, when you engage patients, you're also improving your care and health outcomes, whether you know that or not. Obviously, you want to tailor that health and advocacy communication, but you want to make sure that you're using that too to, if your health center serves a certain type of, a certain population, you can use that message to make sure that, that's why they're advocating, or that maybe that's what's of interest when they're considering, supporting your health center. Another thing that I kind of researched a little bit was, fighting illness, or kind of maybe any type of negativity that exists within the community, or struggles that are going on, with kind of the power of community. So if you want to create a network of patients, like maybe something like a leadership council, or maybe a place where you're asking for community feedback, what is the best way that we can, engage with you? How would you like to hear from us? What would be the easiest way that you can advocate? What can we do better? Things like that. That gives people an open forum, and oftentimes when people feel like their voice is heard, that can lower blood pressure, that can lower rates of depression, kind of giving people a safe space, if you will, where they can talk and engage about advocacy. So that's something to think about. As I said before, make the most of your waiting room. It doesn't mean that you have to turn everything into, to an advocacy thing, but just having a piece of information, something that stands out, that points people to advocacy, or maybe even just bullet points of what the health center does in the community and why it's important to support that. And then, of course, when you're allowing people to advocate, and you're letting them, keeping them updated on what's going on in terms of health center funding, in terms of your, state policy surrounding your work, you're giving them a voice because they know what's going on, and they're able to speak on some of the issues that can affect success of your health center and the work that you do in the community. So, of course, once again, you want to make it easy to take action. And again, start with an easy ask. What, are you asking somebody to, just sign up to get emails? Are you asking them to maybe share their story with a member of Congress? Whatever it is, make sure that you've got your ask easy and clear. Of course, you can engage your all-stars, engage those consumer board members that are also patients, engage, the patients that really stand out and have also, maybe participated and volunteered in some of the work that you're doing. Again, you can incentivize advocacy in the same way that you would do it for staff members. You can also make your health center a resource hub. Make sure that you've got tools available on your website, or tools available there at the health center, so that people, can easily get what they need to get. If they need to sign up, they can do that very easily. If they're interacting with you on social media, make sure those resources are available there too. And then the last point is, perhaps if you have the bandwidth, is by, maybe even something easy like a social media campaign, which I'll show you an example. And what we've done several of them here as well. But one of the examples was Lorain County Health and Dentistry. What they did is they had these sheets that were available, at the health center, where, it says in the words of our patients. But of course, as you can see, below what Lorain County Health and Dentistry means to me, and then you see that people have filled in, you know, what it means to them, what their health center means, and this organization shared these messages on social media, and they use them as part of kind of a broader campaign, you know, throughout National Health Center Week and so forth. So something very simple, and this is something that you could have in your waiting room, simply, you know, writing it, you know, people are able to write it in, and then, of course, you can take this material and then share it, you know, as you see fit, and or even post it within the health center as motivation, whatever you would like to do. But it's just an example of how you might collect patient information for a social media campaign. So I'm still hearing some background noise, so again, one final reminder, if we could mute our lines until questions open up. So moving on, we're going to 10 tips for effective advocate engagement, and we've kind of gone over all of these throughout, but the first is obviously to engage your colleagues first, and I would also add on that to engage your board. Make sure that, you know, they're aware. If you're the leader, if you're the person who's leading up the advocacy efforts, you know, get some feedback from your, you know, from the folks that you're working with directly, and make sure that your board has buy-in as well. Definitely ask your colleagues and staff members to begin talking to patients about advocacy, you know, and letting them know that there are resources available. Of course, you can use NAC's resources at any level to share. We've got plenty of stuff that you can use and recreate and repurpose. So if you're trying to kick things off, or if you need, you know, ideas or tools, please do not hesitate to visit the Health Center Advocacy Network and get that information and use it. Also, collaborate with external partners. Sometimes, I know a few years ago, I went to a really great Health Center Week event, and it was in Meridian, Mississippi. Back to kind of what I said earlier about maybe doing like a service project or engaging with the community, but the health center that I visited had partnered with an organization that also supplied food to the homeless. So on a day that they had a kind of a healthcare for the homeless screening event, that organization came, and they were also giving information about, you know, about their advocacy efforts and what they did. So it was kind of a collaborative thing. So the health center got exposure, and so did another organization. The fifth thing would be to brand advocacy at your health center. I've used them very well at the California Primary Healthcare Association. They have done a great job with, you know, California Health Plus. And, okay, I'm sorry. If we could just, I'm getting another message. If you, again, just one plea, if you guys could please mute your lines if you're not speaking. There is background noise, and I want to make sure that all the other participants are able to hear. Thank you. Brand advocacy at your health center, that could be in a number of ways. You could come up with your own kind of tagline for advocacy. That could be, you know, I advocate because. It could, you know, I actually saw in Esperanza Health Center in Chicago during the Red Alert for CHCs did kind of a Red Alert Chicago for, you know, for their local community. You know, you can brand it and make it specific to your community and your region. The other thing is use data and reports. You can send a data request to us here at NAC at any time, and we are happy to run a report for you where you can see the number of advocates that have signed up at your health center, you know, how much that has grown. If you'd like to see, you know, maybe the number of people who have engaged on a certain call to action. So keep that in mind, and remember that kind of goes back to your strategic plan, and, you know, also showing the advocacy contributes to your overall organizational strategy and how that's growing too. So you have, it can be quantified, you know, the work that you're doing in terms of advocacy. Recognize those advocates who have gone above and beyond, people who have really stepped out and stood up, perhaps in a volunteer capacity, perhaps by, you know, attending a Hill Day, or attending a legislative day, things like that. But make sure that you're recognizing those folks either by, maybe giving a certificate of, a certificate of recognition is easy. You could give them, some type of gift, like I said, like a gift card, anything like that, or maybe just have an employee appreciation day for everybody who has been engaged. Think about that. As I said before, create safe spaces for conversations about issues that may require advocacy. Make sure that you're really having an open dialogue and communication and understand the issues that may affect advocacy at your health center. Let's say you've got people who you're serving a large population of folks that may or may not be, interested in signing up or giving any of their information because perhaps they're undocumented. Those are the type of conversations you want to have. Making sure that you've thought about that before you're just, kind of running forward with a strategy. You want to make sure that you've really thought about those conversations that require safe spaces and how they're going to affect your overall goals. When possible, of course, you guys will be doing this, but attend trainings and webinars, outside of the ALP webinars, which we are going to be having month to month, and then, of course, we'll have our final projects and all of that. But outside of these, we're hosting a number of webinars that are focused on advocacy and engagement. And actually, later today, you probably will see a list of those in the Washington update. But, for example, we're having some of you are board members, we're having an advocacy for board member, one-on-one webinar this Thursday. Or, later on we're going to be having election year advocacy and civic engagement on April 25th. So there are going to be a number of other opportunities for you to, get engaged and understand more about advocacy and kind of the different factors that can affect it and different topics that arise. And then, of course, remember that, we're here to help. If it's not me, we have Elizabeth Klosnick, who's my colleague, and she's also very, very well versed in the field of advocacy and engagement and all of that. So we're always here to help and really from a broad perspective, NAC, outside of public policy and research, which is the division that I'm in, we're all here as a resource. So be sure to keep that in mind. So this is a quote from somebody from Family Healthcare Network in California, and I think it sums up, our goal here with patient and staff engagement. But advocacy is embedded in what we do, and it should be embedded in everything that you do. It should be, just as important as other efforts that you have, whether it's to recruitment, whether it's, whatever it may be, but advocacy should be, at the forefront as well, especially as I just mentioned, as we're moving into kind of an election year, and there are going to be another set of challenges that will arise, even though we've kind of gotten over the hump. So remember to kind of think about that as your kind of North Star, that advocacy should be, involved in every aspect of your health center operation. So one thing I wanted to go over before we open it up for any questions or comments, and like I said, I've received some feedback from you guys on your projects. I've heard some great stuff so far, everything from, kind of understanding and exploring advocacy from a more, state perspective, and then also projects that would kind of focus on recruiting and growing and patient advocacy. So those are all really great. But if you have not thought about a project, which is totally fine, and you're kind of lost on ideas, here are some that could be considered. You could always create a video which features staff or patient testimonials speaking to the value of health centers. A really great example of this, which is on our website, and I've actually, when I send the follow-up email to you guys today, I will share it just so you can see it. We visited Mary Center last summer, and we're able to get some really great sound bites from providers, actually from somebody who had been part of the National Health Service Corps, but a range of folks at this health center about, the value of it and how it's really helping the community here in DC and the work that they do. So that's always a great idea, something visual, something that, you know, is media driven. You can also organize an event during National Health Center Week, which is coming up in August, to increase awareness and educate the public on health centers. You know, this kind of allows you to put something into practice and kind of do, you know, a more, I guess, more practical project where you're, you know, you're not only just, you know, creating an event, but you're actually carrying it out. And I think that would be really great, and for anyone to do. I think that's always a good practice to participate in National Health Center Week anyway, since it's so focused on advocacy and kind of recognition and bringing everyone together. The third idea, which is pretty basic, but I think that it could be good for some folks that may not be as well versed, is just trying to develop an advocacy plan. You could use, you know, some of the content that you put into your big, hairy advocacy goals, but, you know, kind of writing out a advocacy strategic plan, if you will, that will show, you know, what steps you will take to raise your health center's voice and in the broader health center movement and landscape. You could also do a story baking campaign where you're collecting stories from various patients and staff, so you kind of have a database of things that you can share. So this is different from creating a video. This is something where you'd actually be collecting stories, and then maybe you're using those stories for another purpose later. So maybe you might say, like, you know, hey, submit your story here, and then you take a piece of that. Maybe you make a graphic or something, and you're posting that on your social media page, like, hey, did you hear about, you know, Betty? This is her. She's a patient. This is her story, and here's a little kind of blurb about what that means. So you're using that kind of as your content strategy too, but it's really to also kind of have a database of stories and a record of what people are getting from your health center. And then the other and final thing, which some of you have done or on your way to, is achieving the Advocacy Center of Excellence status at your health center. And that could be, you know, part of your final project. There are some guidelines there there are other steps that you have to complete. So if ALP isn't the only thing that you need to cross off, and there's other things that can also contribute to your final project as well. So those are just some ideas, nothing set in stone. You don't have to do any of those things. If you have another idea, or if you have something that you want to run by me or whatever, you know, feel free. But that's just something to think about because August will be here, or actually, excuse me, September will be here before you know it. So, you know, sometimes you might be thinking, oh, I'll come up with an idea next month or the next month, and then all of a sudden it's here, you know. So these are just some things to think about. That is my final slide. I'm going to kind of open it up here, and if you do have a question and you want to unmute your line, you can do so, or you can type a question in the chat box. But if anybody has, you know, any feedback or concerns or anything, now is the time to let me know. But I'd love to hear from you. I see some of you are on video as well, so feel free to share your questions. I'm scrolling down here, so I'm gonna, okay. I don't have any new questions, but as of yet, but like I said, feel free to use the chat box at any time, and I will respond. Do we need to press that? Okay, so okay, great. The first question is from Helen, and yes, the project will be presented. There will be 2 dates in September. I believe it's September 18th and the 25th. We'll split them into 2, so that, you know, to allow for time. But it will be done in a way where you are on a webinar. So, you know, if we're set up like this here, then you would be a presenter, and then you could go through and everybody in the group will hear it. And we do encourage everybody to sit in on the project and support one another. The other question is from Sarah, and about this recording, the recording of this webinar. And yes, this recording will be available. I'm going to put it on the ALP Hub, but all of the webinars that we have, as well as the presentations, will be available to you guys if you ever want to revisit them, or if you missed them and you need to go back and listen. So yes, they will be available. The other thing is that if you have any suggestions, I know I've gotten one suggestion so far about some upcoming webinar ideas, that, like, if there's anything that you guys want to talk about, or there a topic that you have interest in that you'd like me to cover in our webinars over the next couple of months, please let me know. You know, we can stick to kind of the basic curriculum. You know, we were going to go over social media. We're eventually going to go over some other things in regard to Health Center Week. You know, if you have any ideas for something else, please let me know. Another question that I've gotten was, if there are two folks from an organization participating, can they do a joint project? And I think that is totally fine. I will get with you separately about kind of a template for that, but if you're looking to do a report, I would need to know a little bit more information. The slides are going to be available on the ALP Hub, so hcadvocacy.org/ALP Hub. I will send all that information out to you. The slides are going to be available probably before the recording. It takes about 2 days for my colleague Suga to get the recording available, but I will definitely let you guys know. So you will be able to find the slides on the HC Advocacy website. They will also be emailed to you as well. Are there any other questions around patient engagement or future topics or anything like that? And also, I just want to say I've gotten some emails with folks who've gotten conflicts. You know, maybe they're unable to attend the webinars, or they've got some type of scheduling thing. Please do not worry about that. Nothing is going to affect you completing the program and all of that. You know, we'll make sure that it works. I understand that you guys are all very busy and have your own separate schedules and priorities as well. So if you ever have any type of conflict or scheduling issue, you know, do not worry. We'll make it work. If there are not any other questions at the moment, I'm happy to, no problem, Lorelei. I'm happy to give you guys kind of 15 minutes back in your day, and if you do have questions and, you know, they come to you after that, feel free to just reach out to me via email. We can, you know, and we can connect then. And if you, and like I said, just be a little bit patient. I'm going to get the recording of the webinar, and that should be posted. But I will post the slides today and make sure that you guys, you know, have access to those. So if anything comes up, or if you've got any more questions regarding this topic or suggestions for future, let me know. You know where to find me, and I am happy that you guys joined me, and thank you guys for your participation. I am really excited that we've gotten through the first webinar so far. Alrighty, well, thank you.